Poverty is something that affects children before they are even born. Poverty affects the physical, cognitive, and emotional development of children. 1 in 6 children in America live in poverty, so it is important for educators, policymakers, medical professionals, and others working with these children to understand these effects. Children are considered poor if they live in a family with an annual income below the federal poverty line of $25,701 for a family of 4, which amounts to less than $2,142 a month, $494 a week, or $70 a day. Effects of poverty on children begin with their mothers. During pregnancy, their mothers are likely to face multiple stressful life events, including lone mother and teen pregnancies, unemployment, more crowded or polluted physical environments, and far fewer resources to deal with these events. Infants born to women in poverty are at an increased risk for lower birth weight. Children born at a low birth weight are more likely to have special health care needs, are at an increased risk for chronic health conditions such as respiratory problems, poor postnatal growth, and infections. Poverty-stricken families are more likely to use a natural growth parenting style. In this style of parenting, children are more responsible for themselves, and parents do not structure how their kids spend their time. They often do not have resources to enroll kids in extracurricular activities. Living on a low income can bring multiple stresses to parents, such as lack of food, debt, homelessness, and limited social opportunities. This affects family relationships, harms parents' physical and mental health, and contributes to feelings of stigma, isolation, and exclusion. Parents living in poverty are more likely to display punitive behavior by shouting or yelling, and are less likely to display warmth by hugging. Long-term harsh treatment results in insecure emotional attachment to parents, behavior problems, poor goal orientation, and low self-confidence. Low-income children are more likely to lack food security, as well as have diets that are deficient in important nutrients. These children are more likely to be obese than their higher-income peers. This could be due to lack of full-service grocery stores and recreational areas that promote physical activities. Rates of several health conditions such as asthma, chronic cardiovascular disorders, immune disorders, and psychiatric disorders are higher among low-income children. They are less likely to receive preventative medical and dental care. Increased exposure to stress influences gene function and brain development. It affects specific neurocognitive processes such as working memory, cognitive control, and especially language and memory. Poverty has a particularly adverse effect on the academic outcomes of children, especially during early childhood. Chronic stress associated with living in poverty has been shown to adversely affect children's concentration and memory, which may impact their ability to learn. Children in low-income families are less likely to participate in organized activities and often do not have enough supplies or books in the home. Parents have difficulty providing intellectually stimulating toys for their children to aid in cognitive development and are often less prepared when beginning school. The schools these children attend typically have less qualified teachers, fewer resources, and struggle to meet the needs of these students. Inadequate education contributes to the cycle of poverty by making it more difficult for low-income children to get out of poverty. Children living in poverty are at a greater risk of behavioral and emotional problems. Some behavioral problems may include impulsiveness, difficulty getting along with peers, aggression, attention deficit and hyperactivity disorder, and conduct disorder. ACEs are adverse childhood experiences. Violence in the home, having a parent in jail, and emotional neglect increase the amount of toxic stress children face. Children in poverty are more likely to have these experiences than those living above the poverty line. Poor children are more likely to live in neighborhoods where they are exposed to environmental toxins and other physical hazards, including crime and violence. In the case of violence, even witnessing or simply hearing of the occurrence of violence has been linked to adverse developmental outcomes. A study showed that impoverished children had more antisocial behaviors such as aggression and bullying, and increased feelings of helplessness than kids from middle-income backgrounds. Some emotional problems may include feelings of anxiety, depression, and low self-esteem. Poverty increases the risk of mental health illness, including schizophrenia, depression, anxiety, and substance addiction. Poverty can act as a causal factor. Stress resulting from poverty can cause depression. Perceptions of those in poverty are typically negative. They are stereotyped as lacking warmth and competence. The response to this stereotype is often contempt and harmful behaviors towards those in poverty. These negative perceptions affect how people see themselves. Research regarding the effects of poverty on child development are continuing and should be used when working with these children. Using this research can help inform professionals and policymakers to aid in early interventions to help these children.